Hello and welcome. Today, we're diving deep into a fascinating and sometimes alarming eye condition known as conjunctival chemosis. We'll explore what it is, why it happens, and how it's managed. So, buckle up and get ready to learn about this puffy-eyed phenomenon. So, what causes conjunctival chemosis? This condition isn't a disease in itself, but rather a symptom of an underlying problem. Think of it as your eye's way of saying, hey, something's not right here. Common culprits include allergies, particularly seasonal allergies where pollen counts are high. Eye infections like viral conjunctivitis or bacterial conjunctivitis can also trigger chemosis. In rare cases, it can be a symptom of systemic diseases. Angioedema, a type of allergic reaction which causes swelling deeper under the skin, is one such disease. Also, thyroid eye disease and superior vena cava syndrome are also potential causes, or even aggressive eye rubbing or trauma to the eye itself. Let's peek under the hood and understand the pathophysiology of conjunctival chemosis. The conjunctiva, that thin, transparent membrane covering the white part of your eye, has a lot of blood vessels and lymphatic channels. When there's irritation or inflammation, these vessels become leaky. Fluid then seeps out into the conjunctival tissue, causing it to swell. This fluid accumulation is what we see as that puffy, blister-like appearance. Think of it like a water balloon forming under the clear membrane of your eye. Now let's talk about who gets conjunctival chemosis. Because it's a symptom of other issues, it doesn't have its own specific demographic. However, it's commonly seen in people with allergies, especially during peak allergy seasons. Individuals prone to eye infections, whether bacterial or viral, are also at higher risk. It also shows up more frequently in people who are prone to angioedema or who are in contact with eye irritants such as dust or chemicals. What does conjunctival chemosis actually look and feel like? The most obvious sign is swelling of the conjunctiva, making the eye appear puffy and watery. You might notice a clear, blister-like bulge on the white part of your eye. Some people experience itching, burning, or excessive tearing. In severe cases, the swelling can be so significant that it's difficult to fully close the eyelid. While chemosis itself usually doesn't directly affect vision, the underlying condition causing it might impact your sight. How is conjunctival chemosis diagnosed? Usually, a simple eye exam by an optometrist or ophthalmologist is all that's needed. The doctor will examine your eye, ask about your symptoms, and take a look at your medical history, especially regarding allergies or recent infections. In some cases, they might perform allergy testing to identify specific triggers. If the doctor suspects a systemic cause, further blood tests or imaging studies may be ordered. Conjunctival chemosis is more of a symptom than a disease with distinct types. However, it is important to differentiate it based on the underlying cause. For example, allergic chemosis will require an antihistamine treatment, whereas chemosis caused by a bacterial infection will require an antibiotic ointment. Therefore, it is important to correctly classify this symptom based on the underlying cause. The treatment for conjunctival chemosis focuses on addressing the underlying cause. For allergies, antihistamine eye drops or oral medications can help reduce inflammation and swelling. For infections, antibiotic or antiviral eye drops may be prescribed. Applying cool compresses to the affected eye can also provide relief. In more severe cases, your doctor might prescribe topical corticosteroids to reduce inflammation. It's crucial to avoid rubbing your eyes, as this can worsen the condition. If the cause of chemosis is found to be related to more severe conditions, such as thyroid eye disease, the cause must be treated to treat the symptom. Preventing conjunctival chemosis often involves managing the underlying risk factors. If you have allergies, try to avoid allergens as much as possible, such as staying indoors during peak pollen season. Regular hand washing can help prevent eye infections. Wear protective eyewear if you're working in environments with dust, chemicals, or other irritants. And most importantly, avoid rubbing your eyes, even when they feel itchy. The prognosis for conjunctival chemosis is generally good, as long as the underlying cause is identified and treated. In most cases, the swelling will resolve within a few days to a couple of weeks with appropriate management. Regarding recent research and advances, scientists are continually exploring new and more effective treatments for allergies and eye infections, which indirectly benefit individuals with chemosis. Moreover, there's ongoing research into the role of the immune system in the development of eye conditions, which could lead to more targeted therapies in the future. That's it for our look into conjunctival chemosis. Remember, if you experience any sudden or persistent swelling of your conjunctiva, it's best to consult with an eye care professional.